You're listening to Soundside. I'm Libby Denkman. Doctors have long recommended regular cervical cancer screenings, but these tests are, they're not exactly enjoyable for the women and people who have to get them. Traditionally, doctors perform these exams using a speculum. Patients often report that the tests are uncomfortable and, for many, painful. Some recent developments could make a large number of these screenings easier. Last week, the Health Resources and Services Administration updated its guidelines to say that self-administered tests are acceptable to screen for human papillomavirus. HPV is a sexually transmitted disease that causes the majority of cervical cancer cases. This update from the agency, which is part of the Department of Health and Human Services, follows a similar update from the American Cancer Society in December. Last year, the FDA also approved the first at-home screening kit. OB-GYNs are hopeful that at-home testing will make cervical cancer screenings easier to access and significantly more comfortable. Dr. Linda Eckert is a professor of Obstetrics and Gynecology at the University of Washington School of Medicine. She's been performing cervical cancer screenings for over 30 years, and she wrote a book called Enough, Because We Can Stop Cervical Cancer. I spoke with Dr. Eckert last month after the FDA approved the at-home test kit, but before the HHS announcement, and I asked her what self-collection could mean for patients. Here's that conversation. So I'm sure a lot of listeners know what HPV screenings are like. I certainly do. But you're going to have a lot of people out there who don't have any idea about how it's typically done. Can you talk a little bit about what happens when somebody goes into the doctor for an HPV screening right now, currently?
Yeah, thank you for that question. And HPV, as you mentioned, is the cause of most cervical cancer, over 95%. So we have these wonderful lab tests that allow us to detect it that are really sensitive. And traditionally, what has happened is a person goes to the office and they have what's called a speculum examination. And a speculum is an instrument that's placed in the vagina to hold the walls of the vagina open so you can actually see the cervix that sits at the end of the vagina. And that speculum can put pressure on the vagina, and as you mentioned, can be uncomfortable, and in some patients really can cause pain. And that speculum, though, is necessary to collect the swab to see the cervix for HPV screening and also to collect the swabs that we use to do a pap smear. And
So
what
can
we
I
have,
stop you really quickly, doctor? Because I was confused by this when we started researching for this segment. I thought a pap smear and an HPV screening were the same thing. Are they're
yeah,
different? Like, can you explain that just a little bit?
pap smear testing has been around for decades. We started it widespread in the United States in the 1970s. And then what a pap smear involves is taking a sample of the actual cells that line the surface of the cervix and also in the canal that go up toward the uterus, putting those cells in a vial, and then they're looked at under the microscope. And under the microscope, then the trained cytopathologist can tell if those cells are normal or abnormal. Pap smear screening has been very successful in reducing cancer rates, but it's not as sensitive of a test, meaning it doesn't pick up as many of the abnormalities as an HPV test. HPV tests became widespread in the 90s and now have been part of our recommendations for over 20 years. And that is actually a swab that is collected from the upper part of the vagina and the cervix that's tested via PCR or DNA technology for the presence of human papillomavirus or HPV. So it's a physical lab test looking for this virus. And so that both of them are ways to screen for cervical cancer, and sometimes they're done simultaneously. But what is new, as you mentioned, is the idea that now to collect this HPV test, you don't have to have a speculum, you don't have to have a provider. You can do it by yourself, placing a swab in your vagina.
So tell me more about this. I mean, this is addressing an issue that we've sort of glanced at so far in this segment, where the actual tests themselves in the doctor's office, the pap smear and the HPV screening, they can be uncomfortable for some folks. Do you think that this is an obstacle right now for people going in and getting their regular screening? Like, what is the problem that the home test is solving?
I think that home tests can solve a lot of problems. One is, yes, placing a speculum in the vagina for some women is really uncomfortable. And nobody likes it, let's just be honest. None of us
Yeah,
want to sign up for it.
not something people generally look forward to. I don't
Exactly.
generally look forward to it. Yeah.
Exactly. But it's a very useful test that gains wonderful information. Both a pap smear and an HPV test are what we call screening tests in that they pick up the abnormalities. But if you have a screening test that's abnormal, you still need further evaluation to figure out, do you have precancer or not? What would the right treatment be, or and how to approach that. So they're the first step. What HPV screening will allow is that this first step can happen in different settings. It could be in your home. It could be in a mobile van in a rural setting where people don't have access to doctors or clinics on a very regular basis. Overseas, it's being done in tents in the middle of community gatherings. And so it has the opportunity to really allow individuals to collect their own swab in privacy, and then that swab can be tested. And so that first step of the screening can really have better access.
So we've talked about the fact that these screenings can be uncomfortable for some women. In your professional experience, who generally is facing the biggest obstacles or the biggest discomfort in this process?
Well, there are some physical conditions that lead to contraction of the muscles in the vagina and also really sensitive skin on the outside of the vagina that can make a speculum literally almost impossible to place. And those people with those conditions are people who really suffer from trying to endure a speculum placed for cervical cancer screening. And then another thing is people who've been sexually assaulted. And in our culture, we know that 20 to 40% of women are sexually assaulted. And just having the intrusive nature of a speculum can re-exert that trauma for them. So that's another case. And then a third case is individuals who are having gender affirming care and have vaginas and cervixes, but may not have much lubrication or much estrogen around. And the speculum can be quite uncomfortable, not to mention a little bit of psychological disturbance just having a speculum placed in a vagina.
If currently a doctor has to use the speculum, the metal sort of reverse plier thing to take a sample, how is it possible that somebody can take an accurate sample at home with a swab? How does it work?
Well, the tests themselves are very good. They are great at picking up even a small amount of virus that's in the vagina. And so over the years, there's been a lot of studies of this. And we've learned is that when the provider collects a sample, yes, it is a little more likely. It's called 92% sensitive to pick up HPV if it's there. And self-collection is 89% sensitive, so it's not quite as good, but it's still really good. And both of those tests perform better at picking up abnormalities than the pap smear. It's easier to miss cells on a pap smear than it is to miss the virus doing these tests. And so essentially, when you have the fluid in the vagina, it is collected on a swab, then you place them in similar to how you would place a tampon, really, and collect fluid, and then it goes in a vial that gets sent to the lab. But I do want people to realize that most of the time, getting a self swab when the test is negative will put the cervical cancer screening to rest. But occasionally, it will raise a question that needs careful follow up and may still need the visit to the provider and the speculum placed so the cervix can be fully visualized.
So, I mean, are you advising people to make their own decisions if they are thinking about these kind of home screenings? Are they specifically, do you think, better for people who are uncomfortable with an in doctor's office test? Or how should people kind of approach this, do you think?
Well, I think it's an opportunity for patients to have more control and more decision over their own screening. And I would say that this, again, the screening test is just the first step. if it comes back abnormal, you still need a way to get follow-up for that, and you still need to get notified of those results, and you still need to have somebody who's responsible to follow up those results to get in touch with you. And so, really rolling out self-screening for everybody in our country right now, we're not quite ready for that. We don't have all those systems in place that will allow us to do that really easily yet.
If somebody uses the self-screening method, how often are they going to need to be tested?
Yeah, right now, the American Cancer Society in December recommended that if you use self-screening, you get tested every 3 years. And if the provider collects the screen or the sample, that is every 5 years. And probably eventually those two will align and self-screening will be able to go to 5 years. But for right now in our country, we don't have a lot of long-term data and it is just a little bit less sensitive. So that is why the American Cancer Society right now is saying you can use a self-collected swab every 3 years for HPV testing, or you can use a provider-collected swab every 5 years.
Dr. Eckert, how do you think this might change outcomes for patients? I mean, you've done so much research over the years. You've been doing these screenings for decades. You've also written a book about ending cervical cancer. I mean, what does this home screening development mean, do you think, for outcomes for patients?
Well, what has been found in other countries, for instance, England, Canada, Sweden, is that more people get their screenings done. And, screenings only work if you do the screening. And currently, in parts of our country, especially rural areas or areas with difficult access, we have 50% of women not getting screened in the recommended time frame. And so, what we really hope is that we can just increase the number of women or the number of people with a cervix who don't identify as a woman, because that's another big obstacle to screening, and use this self-sampling to improve access and therefore improve prevention of cervical cancer.
What is our picture of cervical cancer right now? Since the advent of the HPV vaccine, how big of a threat is cervical cancer today?
Yeah, I'm so glad you're asking this because it is a big threat. We still have a woman dying every 2 hours in the United States from a preventable cancer. And the majority of, well, 50% of people who get cervical cancer are not up to date on their screening. And so that's one big challenge. But another big challenge remains access. We have more cervical cancer in rural areas than urban areas. We have more cervical cancer in people of color than not. But what we are seeing is that the HPV vaccine is making a difference. We're already seeing that younger people are getting less cervical cancer because of the HPV vaccine than older people. And unfortunately, though, there are still many, many people in our country that are not taking advantage of the HPV vaccine. And so we actually have places in our country where cervical cancer is increasing right now, even with screening, even with HPV vaccine, because people aren't able to take advantage of the screening. They can't afford it, they can't access it, and people have chosen not to get the HPV vaccine.
We talked about the ways that pap smears and HPV screenings, when you go in and you have the speculum and there's the swab, that can be very uncomfortable. The cervix poke for many women, and it's for some women just not a situation that they want to put themselves in, and then they delay screenings, and that can be a big problem. I'm also thinking about other ways in which women's healthcare can be uncomfortable. I mean, people talk a lot about the pain of IUD insertion, for example, being something that prevents them from choosing that for a birth control method. It seems like we are having some progress here with the take-home HPV test in terms of really taking that pain seriously and finding other ways to offer healthcare that maybe doesn't put women through and people with a cervix through pain. Why do you think it took so long, doctor? Like, was it simply that the technology for the test wasn't there, or is there something about how we've kind of tolerated women's pain in healthcare for too long?
Oh gosh. I agree with both of what you said. And I think we saw recently in our culture, for instance, our commander in chief saying women shouldn't take Tylenol in pregnancy. And I suspect he would never tell a man not to treat his pain. So I think we have long-standing medical biases related to pain women endure for labor, childbirth, for breastfeeding, all of those things that are very specific to people with a uterus. And that as a culture, and cultures all over the world, put up with that. I do think that we are getting smarter about saying, do we have to put up with that? What can we offer? And also at the same time, the technology is improving, certainly in this case of HPV. And so I'm hoping that, yes, both things can come together and align and say, women deserve to be treated with the least discomfort possible to prevent these preventable things like a preventable cancer. And we can do better, and we should make that possible for them.
Something about you saying women deserve to be treated with the least discomfort possible felt revelatory to me, and I felt my shoulders relax a little bit. And so perhaps I need to examine that a little bit further, maybe in some therapy. But thank you for joining us with your expertise here, Dr. Linda Eckert, professor of obstetrics and gynecology at the University of Washington School of Medicine. And she is the author of Enough, Because We Can Stop Cervical Cancer. Dr. Eckert, anything else you want to add before we go?
I do want to clarify just a little bit about HPV testing because it creates confusion. HPV is an incredibly common virus. 80% of women will have HPV at some point in their lives. And the good news is that most types of HPV do not lead to cancer. And in fact, there's only 12 that we really test for. And that even then, those 12 types most commonly go away on their own. 90% of the time, our bodies will fix it and get rid of the HPV. So if you get a positive HPV test, really what that means is that you have to stop, pay attention, get more information, and do the follow-up testing you need. And hopefully your body will fix it on its own. But then if it doesn't, that's when we have other options for how to address it and how to address precancer so it doesn't become cancer. But mostly, I don't want women to panic if they get a positive HPV. I want them to seek out information and do the follow-up they need.
Dr. Eckert, I really appreciate your time today. Thank you.
Thank you.
Thanks for listening to Soundside. Don't forget you can listen live on KUOW 94.9 FM Seattle at noon and 8 p.m. Monday through Thursday, or anytime online at KUOW.org or on your favorite podcast app.